Welcome everybody to the A Little Less Fear podcast. I'm your host for the show, Dr. Lino Martinez. Oh yeah. Welcome back, everybody, to the A Little Less Fear podcast. I am super duper duper excited to introduce Mercedes Killeen. Mercedes, welcome to my show, A Little Less Fear podcast. Thank you very much for being here.
Thank you so much for having me here.
You're welcome. Mercedes Killeen, she's an editor, writer, digital content developer, and a mental health advocate for everybody, along with people with sobriety and the LGBTQ plus community. So I'm more than happy to welcome you. These topics have actually been ongoing on my podcast. As of June passed, it was LGBTQ plus month, and I interviewed all kinds of people. I found that mental health is one of the biggest things that a lot of people are struggling. I mean, overall, in general, people are struggling, but even more so in the LGBTQ community. But before we go into this, I want to ask you, what brought you to this journey specifically?
Yeah, I mean, I've always loved writing and literature. So I've been doing it since I was little. And in terms of the mental health work, I kind of spent most of my life just like in denial that I had mental health issues, even like though everyone in my life was kind of like telling me to get help. I was very ashamed of it. Like I didn't want to admit that I had it. And then finally, when I started accepting help, then I got a little bit more comfortable like talking about it and eventually kind of blended it with my writing work. And, now it's something I like to talk about all the time because, for most of my life, I spent like, I was very kind of ashamed of it. Yeah.
And you were ashamed of it because of what people were saying around you, or because of things you were seeing online, or what made you ashamed about mental health, about taking care of it?
Yeah, I don't really know. I guess in some way, like, because I didn't have like a very good understanding, I saw it as like, oh, maybe some type of weakness or something that like, was like out of the ordinary, like something was wrong with me kind of thing. And like, I just felt, yeah, just kind of like it wasn't okay to talk about. And like, it wasn't something I wanted to share with people. But yeah, once I started getting help and like, learning more about it and realizing, it isn't a weakness and things like that, then, yeah, it just became a lot more open about talking about it. Yeah.
And what was the turning point that made it okay for you to talk about it?
I forget his name, but I saw this TED talk about this comedian, like a young comedian, kind of talking about having depression and how he kind of like used public speaking and comedy to kind of like raise awareness and things like that. And I had never really thought about it that way. Like I didn't ever think that it could be a force for good or like a positive thing. So kind of seeing this person being so open about like their mental health and even talking about, how it's helped them like connect with others and like raise awareness, that kind of like shifted something for me where I was like, oh, maybe I can do this like with my own writing. So,
Wow, what an impact that had on you.
yeah.
And so how are you using that now to help other people and to help yourself?
Yeah, for me, I just write very openly about what it's like to have mental illness, what it's like to be hospitalized for mental illness, what it's like to deal with suicidal thoughts or things like that. And yeah, I just try to like hold space and, and kind of hope that like by taking up some space as like an openly like mentally ill person that it does raise some level of awareness and hopefully people don't feel as alone and they can see that there's a lot of people dealing with this and it's nothing to be ashamed of really. So yeah, that's kind of my goal. And meeting people after like poetry readings or stuff and they tell me about their story, like that's kind of what makes it worth it.
Yeah, it's super duper therapeutic.
Yeah.
I mean, I totally agree with you. There's absolutely positively, no shame in feeling the way that you're feeling, because we're all humans, all suffering together collectively, and we're all trying to survive together.
Yeah.
So hiding, actually, not only do you hide, it doesn't benefit you, it won't benefit others, but when you start to learn to shine with an illness,
Yeah.
then it doesn't become such a bad thing after all.
Yeah, absolutely. Yeah,
And the
100%.
beautiful thing about all of this is also that you get to connect with other like-minded people
Yes,
and help
absolutely.
give each other ideas on how to blossom and bloom.
Yeah, for sure. And I've definitely noticed in like writing communities and stuff, it's definitely a common topic. So yeah, it's really nice to connect with others. Yeah, about those things.
Is there a specific topic in mental health that you like to cover?
For me, one big part of my journey was getting a diagnosis of having borderline personality disorder.
Hmm.
I think it's something that isn't really spoken about as much. You hear a lot about depression and anxiety, which is great, but there's also a lot of other conditions that are maybe a little less spoken about and maybe more
Right.
stigmatized, like bipolar, like schizophrenia, like borderline. So yeah, for me, that was a huge turning point in my journey, because I always just thought I had depression and anxiety. That's all anyone had ever really told me. And then when I asked about it, they were like, yeah, like you probably do have borderline as well. So that's something I like to talk about because it maybe is left out of the narrative sometimes.
It is left out of the narrative. And one thing I found, being a having my doctorate in psychology and
Yeah.
having I used to see patients at a dual diagnosis center. I find that
Mhm.
a lot of these people with these personality disorders are quite
Mhm.
geniuses. They're really, really smart.
Mhm.
And my fear with with giving people these labels and putting them in these categories is that they're not seeing the things that could help them
Mhm.
develop more as a person, and those are their gifts,
Mhm.
because a lot of
Yeah.
these people have a lot of special gifts to give, and a lot of the times we can quiet down those other voices or those automatic voices and
Mhm.
bring up the positivity that's brewing
Yeah.
inside. A lot of
Yeah.
the times when people are having manic episodes or voices or in between
Yeah.
moods, it's because there's a lot of internal energy that just needs to be released. And a
Yeah.
lot of the time I found that that's creative energy. And a lot of the
Yeah.
people don't even know that they have this creative pursuit that's boiling inside them, that's able to come out if it just gets explored.
Yeah, that's so interesting for you to bring up. Like, how I never really thought about how closely tied creativity is with those sorts of things.
So tied with it. I've never met anybody that wasn't schizophrenic or that wasn't bipolar or borderline or histrionic or whatever label you want to put on it, that
Yeah.
didn't have a creative a force inside them, whether it was music, whether it was painting, whether it was writing, whether it was makeup, whether it was designing, whether it was wedding planning, whatever
Yeah.
it is, there's a creative force, and that energy is what mixes with all the other energies where we're trying to be normal with society, but it doesn't happen that way, because we're here for a reason, and we want to fill that purpose, but we're not even aware of it because we've got so much going on in our mind. And
Yeah.
that's what I've actually realized, that meditation has been really helpful for a lot of people, because you're able to
Mhm.
hone in down on what it is that's going to help you have that creative pursuit.
Yeah, 100%. I love meditation and yoga and all that, those sorts of things. Yeah, they help a lot.
Have you found that it's helped you focus on specific topics or subjects?
Yeah, I find it just helps in general. Like it's almost like it's like a little like vaccine or something. Like when I take it, if I do my mindfulness, it's not
Yeah.
that I'm going to have a perfect day. It's just that there's a little bit more space between like those emotions and those thoughts and then like the awareness. And yeah, I find like when I'm not keeping up with my mindfulness practice, then I can get a little bit more reactive or like caught up in my emotions and my thoughts. So I find it helps so much, yeah, with the BPD specifically. Yeah.
For people that don't know what mindfulness is there any way you could explain it in easy terms, what it means to have a mind of being mindful or mindfulness? Because I've read like some some disagreements with that word, but I
Yeah.
agree with being mindful. But one thing that I once read was that mindful is not a healthy word because it means that
Mm.
your mind is full. But then
Oh,
for some readers, they say mindful is a good reader, is a good word, is a good positive word because you're holding your mind and you're able to just be a little more aware of other
yeah,
people. So it's
yeah,
like I'm finding these like counter, like, like counter definitions
yeah,
on these, but I personally see the more positive side about on being mindful. I don't
yeah,
really see it as your mind being full. It's not really spelled that way anyway.
yeah.
So, how can you explain what being mindful is?
I think like John Kabat-Zinn, I think he calls it like moment to moment, like non-judgmental awareness, which I kind of like.
I like that.
It's yeah, having that like non-judgmental kind of attitude. Yeah,
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 that's probably the best way I've ever heard it said. Yeah,
yeah. He's a great
non-judgmental
expert.
attitude for sure.
Yeah, yeah,
That's how I feel mindful is as well. Exactly.
yeah.
So once you give yourself that space, that tiny little space, whether it's what, a few minutes or a few seconds, you're able to pause a little bit. Is that what you mean by giving yourself space?
Yeah, yeah. I just find it helps give me that level of awareness of, being able to kind of realize like that you aren't your thoughts or you aren't your emotions. Like you can have that kind of like step
Right.
back and like watch those things happening. And yeah, it helps a lot. I usually, I'll only meditate for maybe a minute or two, and then yoga, I'll just do like maybe like a 10-15 minute thing. But I find even a little bit really goes a long way. Yeah.
That's so important to think that way, and it's really helpful for our audience to listen to what Mercedes just said as far as you are not your thoughts, and there's nothing more true than that. I was listening on this podcast a while ago. This this Buddhist monk was saying that
Mhm.
the reason why you're not your thoughts, and a good way for you to question yourself this is like when you think of something, you're physically, your body can go somewhere, but your thoughts don't have to go with, you know what I mean? Your thoughts don't go
Yeah.
with you. Your thoughts can be
Yeah.
anywhere at any given time. So they're not a part of your body physically. So you are not
Yeah.
your thoughts.
Yeah.
And it just made sense to me, and it totally makes sense. Like
For sure.
yeah, that's very, very helpful.
Yeah.
Thanks for bringing that up.
Yeah.
Is there a specific community that you usually target as far as when you write, or when you think about like mental health? Is there a specific community, or do you just do this as far as advocating for like the general public?
Yeah, I think in general, it is kind of hard to separate I identify as queer or like bisexual. So it is hard to kind of like separate the two. Like I feel like there is definitely some like overlap in between like how mental health issues can especially affect the queer community and especially bisexual people. And yeah, like there are definitely like higher rates and stuff. So I feel like I do the writing work to appeal to really anyone, like whether you have mental health issues or not. Like, you probably know someone, or, someone you care about probably deals with some level of mental health issues. So I do it more for like the general public, but yeah, it's hard to separate from also like queer identity as well.
Do you find that being open about a queer identity helps other people open up to you with the same identity, or does it just help in general?
Yeah, I guess it's more in general. Like to me, honestly, I still have yet to like sort of find like that queer community for me. Like most of my friends are straight. And yeah, I came out like maybe only like 4 years ago or 5 years ago. And I haven't really been to like a lot of like LGBT plus like events and stuff. So I'm still like kind of searching for that more like community of like other people who are queer as well. But, yeah.
And you are where, in what city or what country are you?
Toronto.
Oh, okay,
Yeah,
great,
yeah,
awesome. And
yeah.
then is it because of the pandemic that it's been a little more difficult to find a community? Do you find that maybe that's given it a little bit more challenging?
Yeah, I think so. And also just like I have like a lot of social anxiety. Like I'm not like a big like putting myself out there like often like socially. So like kind of my close friends, we've been friends for many, many years, and they happen to not be, LGBT plus. But yeah, I mean, it does help to be open regardless. Yeah.
And yeah, well, welcome to the community, by the way. Yeah.
Thank you.
Yeah, it's interesting for me. The word queer, I'm finally barely starting to understand it because I mean, I'm gonna be 42 years old, and
Yeah,
in my in my lifetime, the word queer wasn't a happy word. It was
for
actually a very
sure.
negative, derogatory word.
Yeah.
But now I can safely say that, but I still, kind of bite my tongue before I do when I'm around people my age and above because they're not
Mm,
used to that word. But I'm now
yeah.
seeing a lot more color with that word, and I think it's actually becoming really beautiful. Queer to
Yeah.
me now sounds a little more happier than what it used to. So thank you so much for being open about that and
Yeah.
coming out and being free with it.
Thank you. Yeah.
I can definitely tell you that you won't have any issue navigating through the community. You know you only
Yeah.
have 4 years, but it's like once you get your foot in, everybody's super duper welcoming.
Yeah,
Once you get your
absolutely.
foot in.
Yeah.
Well, once you open up, then other people open up with you, and then everybody's
Yeah.
super duper cool after that.
Yeah, for
So tell us
sure.
about your writing. Like what lights you up? I mean, I'm assuming that's one of the things that lights you up.
Yeah, I love writing. I've always been drawn specifically to poetry. That's kind of where like most of my writing career is. I've always loved poetry. So yeah, most of my career has been publishing it. I have two books out. One's called Tulips and the other is called Using a Spoon as a Knife. So I work with a publisher here in Canada called Grey Borders Books. So yeah, that's been the bulk of my work is my poetry work, and just giving readings or workshops and talks about the writing process and how that intersects with like mental health and things like that. Yeah.
What kind of talks do you give as far as like the writing process? What do you mean by that?
Yeah, so I went to U of T, University of Toronto, and took some creative writing courses with a prof called AF Moritz. And so after I had left U of T and I was no longer a student, I was invited to be a guest lecturer in the course that I used to be a student in. So I've done that a couple times where I go into like a creative writing class and read my work and just kind of give my story about like getting published and the kind of the subjects that I cover and yeah, just like my journey and everything. Just showing as what a writing career can kind of look like and how you can move from being a student to being more like a professional author and things like that.
And how was that creative pursuit? How did that even come to your mind? Were you just one day like, you know what, I like what I do, I love what I do, and I want to write a book about it? How did that happen? How did it come into fruition?
Yeah, like honestly, I got my first like poem like published when I was like 13. Like it started very, very early. Yeah, very early. And then once I took those courses at U of T, I wrote both of my books. So like for the first workshop, I wrote my first book, Tulips, and then during the course of the second workshop, I wrote most of my second book. So they were really, yeah, like really wonderful experiences. Yeah.
And have you found that your people are reaching out to you and asking you questions about the process?
Yeah, and I also work as a freelance editor. So, as an editor, I specialize in editing poetry manuscripts. So, I have a lot of
Wow.
writers that I work with. And then, even after we've edited their book, like we
Hmm.
still keep in touch and are talking about like publishing and writing and things like that. Yeah.
Wow, that's really amazing, Mercedes.
Yeah.
That's awesome that you do that.
Thank you.
Would you happen to have anything you could share with us?
Like a poem or to read?
Yeah, totally.
I don't know. I don't have any ready.
I'm sorry to put you in the spot.
Let me see if I can get something. Let me see. I can pull it up.
Cool, thank you.
Yeah, no problem. Uh,
And so while you're looking that up again, the name of your books, the one of them is called Two Lips. Two Lips.
Tulips. Yeah, and then the other one is using a spoon as a knife.
Using a spoon as a knife, which I've done.
Yeah.
I just did last night.
Oh, really? Oh man. Let me see if I can. Okay. Let's see. So
These are the words, poetry coming from Mercedes Killeen. You can find her at mercedeskilleen.com. That's Mercedes, KILLEEN.com.
yeah, I guess because we were already talking about borderline and things like that, maybe I'll read one. So this is one in a series. And so all of them start with the same author's note, which is the following poems are composed solely of criteria from the DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders. Not exhaustive, some punctuation added for effect. So I'll just read the one, which is BPD. So BPD, borderline personality disorder. Emptiness, neediness, idealization and devaluation, unstable emotional experiences, frequent mood changes, emotions that are easily aroused, intense, and or out of proportion to events and circumstances. Intense feelings of nervousness, tenseness, or panic, often in reaction to interpersonal stresses, worry about the negative effects of past unpleasant experiences and future negative possibilities, feeling fearful, apprehensive, or threatened by uncertainty, fears of falling apart or losing control, fears of rejection by and or separation from significant others, associated with fears of excessive dependency and complete loss of autonomy, frequent feelings of being down, miserable, and or hopeless, difficulty recovering from such moods, pessimism about the future, pervasive shame, feelings of inferior self-worth, thoughts of suicide and suicidal behavior. Acting on the spur of the moment in response to immediate stimuli, acting on a momentary basis without a plan or consideration of outcomes, difficulty establishing or following plans, a sense of urgency and self-harming behavior under emotional distress, engagement in dangerous, risky, and potentially self-damaging activities, unnecessarily and without regard to consequences, lack of concern for one's limitations, and denial of the reality of personal danger. So that's just, one in the series.
Wow, that's really powerful. And it was very vivid, and I was able to feel what you were describing. And in the midst of feeling everything, I was also thinking, like, you're actually super duper motivated considering all of this heaviness that is hard to come out of. So how do you motivate yourself when you are feeling like stuck? And thank you for sharing. That was awesome.
No problem. Thank you so much. It's hard. I find with borderline, the main thing that's helped me is mindfulness, and then also DBT, or dialectical behavioral therapy, for the audience.
Yeah, what is that? Dialectal behavioral therapy.
Yeah, so it's started by Marsha Linehan, and it's basically, I probably won't summarize it perfectly, but it's specifically designed for people with borderline, or who have like a lot of suicidal or self-harming behavior. There's a lot of different modules, like distress tolerance or mindfulness and different things like that. But it was originally designed specifically for people with BPD, so I do find it very helpful. So kind of using those tools has helped a lot.
What's one of those tools?
I think the biggest thing for me is a DBT principle called opposite action, which is just basically when you're really in that difficult mental space where, all you want to do is kind of stay in bed and not do anything and not talk to anyone and just kind of isolate, then, trying to gently take the opposite action of okay, I feel like isolating, I'm going to maybe try texting a friend, or, just trying to do that opposite action, not pretending that you're not feeling the feelings, but just trying to challenge yourself a little bit to just do the opposite of what kind of your mental illness is telling you to do. I find that helps a lot. Yeah.
Yeah, that's really powerful too, because what you're also doing when you're doing the opposite of what your brain is telling you to do is you're rewiring your brain to think differently. Like you're
Yeah.
building other bridges, you know, other
Yeah.
freeways.
Yeah.
That's really awesome. I mean, it
Yeah.
sounds to somebody that's not dealing with it, it sounds like, well, that's simple, but it really isn't that simple. Because I mean, I have a
No.
genetic disease. I don't know if you read was on my website or not, but there's
Yeah.
times where I just don't want to get out of bed either. And then sometimes I'm like,
Right.
just do it, you know? And it's like once you do and you get going, it's like you build
Yeah.
another freeway and you're able to just kind of flow on that road.
100%. Yeah. Yeah.
Well, geez, thanks for sharing, Mercedes. This has been
Yeah.
really awesome. How
Yeah.
can we get a copy of your book? How can our audience find your book? Your books?
Yeah, well, you can go to mercedesclean.com. All of that is linked. Or you can go to grayborders.com. That's gray with an E, not an A. So you can go to grayborders.com and go through the bookstore there. But otherwise, everything's linked through my site. Yeah.
Greatborders.com. I'm definitely gonna get myself a copy. It's been a
Oh,
pleasure interviewing you. Thank you so much for being open and raw and honest. And
yeah.
this is what our audience needs and wants and loves. So, with
Yeah.
so much love from our audience to us, thanks so much for sharing yourself. And I look forward to interviewing again in the near
100%.
future. I
Yeah.
noticed on your that you also have a topic on sobriety.
Yes. Yeah, I
Yeah,
do.
so I'm going to be covering sobriety coming the new year. I'm going to have like a month's
Amazing.
worth of talking to people about sobriety and stuff. So I look forward
Awesome.
to having you back on the show.
Yeah, I'm excited. It'll be good.
Thanks, Mercedes. Keep
Thank
writing,
you.
keep benefiting the world, and keep lighting up.
Thank you so much.
Thank you.